Hello and welcome. Today we'll be diving into a serious kidney ailment known as mercury nephropathy. This condition arises from exposure to mercury and its detrimental effects on the delicate structures of the kidneys. Join us as we explore its causes, mechanisms, symptoms, and the current approaches to managing this concerning disease. Mercury nephropathy stems from exposure to various forms of mercury. This can include elemental mercury, inorganic mercury compounds such as mercuric chloride, and organic mercury compounds like methylmercury. Exposure pathways include occupational hazards, like mining or manufacturing where mercury is used, environmental contamination through contaminated food or water, certain traditional medicines, and, in rare instances, from exposure to mercury containing dental amalgams. Although this is a subject of ongoing debate and not typically a significant source of exposure, the pathophysiology of mercury nephropathy is complex. Upon entering the body, mercury is distributed to various tissues, with the kidneys being a primary target due to their role in filtering waste. Mercury accumulates within the renal tubules, particularly the proximal convoluted tubules. Here, it causes direct cellular toxicity, leading to oxidative stress, mitochondrial dysfunction, and disruption of cellular transport mechanisms. This damage results in tubular necrosis, inflammation, and ultimately, impaired kidney function. Specifically, mercury's affinity for sulfide groups on proteins disrupts crucial cellular processes affecting protein synthesis, enzyme activity, and membrane integrity within the kidney cells. Epidemiologically, mercury nephropathy is most prevalent in populations with occupational exposure to mercury, such as miners, industrial workers in chlor-alkali plants, or those involved in the production of mercury-containing products. Geographically, regions with significant mercury deposits or contaminated environments show a higher incidence. Consumption of contaminated seafood, especially in areas where mercury levels are elevated, also contributes to the risk, particularly with methylmercury. Data collection is often challenging, as mercury exposure can be subtle and the onset of kidney disease gradual, making precise epidemiological tracking difficult. The signs and symptoms of mercury nephropathy can vary depending on the severity and duration of exposure. Early symptoms may be subtle and include proteinuria, the presence of excessive protein in the urine, and microalbuminuria, small amounts of albumin in the urine. As the condition progresses, individuals may experience edema or swelling, particularly in the ankles and feet due to the kidney's reduced ability to regulate fluid balance. Fatigue, nausea, and loss of appetite are also common. In severe cases, acute kidney injury can occur, leading to oliguria, decreased urine output, and even anuria, the absence of urine production. Long-term exposure can result in chronic kidney disease, characterized by a gradual decline in kidney function, eventually leading to end-stage renal disease requiring dialysis or kidney transplantation. Diagnosing mercury nephropathy involves a combination of clinical evaluation and laboratory testing. A detailed history of potential mercury exposure is crucial. Urine mercury levels are typically measured to assess recent exposure. Blood mercury levels are also assessed but reflect more recent rather than chronic exposure. Kidney function tests, such as serum creatinine and blood urea nitrogen, (AuBNN), help determine the degree of kidney impairment. Urinalysis can reveal proteinuria, hematuria of blood in the urine, and the presence of tubular casts. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of renal damage. Histopathological examination of the biopsy specimen can reveal characteristic features of mercury toxicity, such as tubular necrosis and interstitial inflammation. While mercury nephropathy doesn't have distinct subtypes, it can be classified based on the duration and severity of exposure, leading to acute or chronic presentations. Acute mercury nephropathy is characterized by rapid onset of kidney injury following a significant exposure, while chronic mercury nephropathy develops gradually over time due to prolonged, lower-level exposure. The treatment and management of mercury nephropathy focuses on removing the source of mercury exposure and supporting kidney function. Chelation therapy, using agents like dimercaprol EDBL, Succimer DMSA, or dimercaptopropane sulfonate DMP-SUS, is often employed to bind to mercury and promote its excretion from the body. However, chelation therapy can have side effects and must be carefully monitored. Supportive care includes managing fluid and electrolyte imbalances, controlling blood pressure, and dietary modifications to reduce the burden on the kidneys. In cases of acute kidney injury or chronic kidney disease, dialysis may be necessary to remove waste products and excess fluid from the body. Ultimately, in cases of end-stage renal disease, kidney transplantation may be required. Prevention is paramount in mitigating the risk of mercury nephropathy. This involves minimizing exposure to mercury through various strategies. Occupational safety measures, such as providing protective gear and ensuring adequate ventilation in workplaces where mercury is used, are essential. Public health initiatives to reduce mercury contamination in the environment, particularly in water and food sources, are crucial. Educating the public about the risks of mercury exposure from certain products and traditional medicines is also important. Promoting safer alternatives to mercury-containing products is another key preventive measure. The prognosis for mercury nephropathy depends on the severity of kidney damage and the promptness of intervention. Early diagnosis and removal of mercury exposure, coupled with chelation therapy, can improve outcomes and potentially reverse some of the kidney damage. However, in cases of severe or prolonged exposure, chronic kidney disease may develop, leading to a less favorable prognosis. Recent research is focused on developing more targeted and less toxic chelation agents, as well as exploring rhinoprotective strategies to mitigate the effects of mercury on the kidneys. Ongoing studies are investigating the long-term effects of low-level mercury exposure on kidney function and the potential for early biomarkers to detect subclinical kidney damage. Nanotechnology is also being explored for targeted drug delivery to the kidneys to enhance the efficacy of chelation therapy.